Hi everyone, and welcome back to my channel. My name is Kieran. In today's video, I would like to give you a little bit of an update of what's been going on and just give you some more information about a recent doctor's appointment that I had. So today I was actually able to have an appointment with the maternal fetal specialist. So if you watched last week's video, I shared that I went to my OB, and the OB was sharing with me that he thought that pregnancy for me would be high risk because of a heart condition that I have. And so he referred me to maternal fetal medicine, and I actually was able to have that appointment today. I just wanted to share with you sort of where everything is right now and what we know and what we still don't know, and what we're still trying to figure out. So so let's just get into this video. So as I said, I had the appointment this morning. They were able to get me in for this appointment really, really fast. I think they called to schedule the appointment on Thursday or Friday, and it was for this week, which was just awesome. So I was able to meet with them this morning, and I really didn't know what to expect at this appointment. I wasn't sure, I had a feeling it would be like a lot of information collecting, and just sort of like, sorry, Finley just walked into the table that I'm using to film. Finley's my dog, if you didn't know. But I figured it would be like a lot of like information collecting and just sort of like an informative kind of appointment. So we ended up meeting with the doctor for about an hour. We thought he was great. We thought he asked really great questions and gave us good information. And it's hard because it's sort of, I still sort of feel like we're at the same place that we were before. And it's interesting because this is the first time that anybody's come with me for the appointment. Sean was able to come with me today for the appointment, which was amazing. But we both left the appointment like kind of in different places, I guess, just in terms of like comfort and how we felt about everything. And I don't know if it's because it's me, it's my body experiencing these things. The doctor asked a lot of questions about history and everything. He unfortunately didn't have all of the access to my records that I thought that he did because it's a different hospital network, I guess. So he was able to have some access to some records, but not everything, like not all of the tests that I've had. And so pretty much what he was saying is that the risk that I face with pregnancy it comes down to concerns about my aorta and like the diameter of my aorta, if it's enlarged, and what that poses a risk like with pregnancy for me, and like my safety and my health. He thought that based on the information that he had, small amount of information that he had from that was like sort of in my file, that my heart function looks good, and at the time when the first test was done, that my aorta looked okay too, but I had another more like intense test, I guess you could say, where it was more I guess closely looking at my aorta. And after that test, the doctor had said that that my aorta was like kind of enlarged for my height, not anything to be concerned at that time with, but we didn't have that number, so we don't really know exactly what that amount is. So that could be definitely play a factor into things. And that's what the doctor said today, that he, based on the one test that I had, it seemed okay. But then, I had told him that the doctor had mentioned something about, the enlarged aorta for my height. And so we will have to see how that goes. I'm going to send my cardiology records to him so he can see that. And one of the main things that sort of came out of this today were that he has referred me to another cardiologist, and I think that cardiologist focuses more on like maternal cardiac concerns. And that like is like the main takeaway. That's the main thing I'm going to be doing is going to another cardiologist. I not like I'm going to have to see another cardiologist like consistently, but he wants another opinion from a different cardiologist because my cardiologist, when I first spoke with him, he didn't know if pregnancy would be safe. Because that's not like his area of expertise. So that's why he sort of, I think, asked me to look further into it with different specialists. So this cardiologist, I think, has more of a focus on maternal cardiac concerns. And I'll go to this doctor and he'll be able to look at everything, look at my chart and my, history and everything and see what is, what if he sees anything that's concerning, because he was saying, today that pretty much kind of what he was saying is that, he doesn't think that he says, I can't really say either way at this point, like if it's fully safe or if it's fully not safe. Does that make sense? Like he was kind of saying like, I don't feel comfortable saying absolutely yes, and I don't feel comfortable saying absolutely no at this point. That there's just more investigating that he wants to do. He kind of leaned, I mean, Sean was encouraging me about this. Like I was definitely like, I was not very positive. I just felt like in my head, like I've just been very like cautious, I guess, with all of it. But Sean was saying that it seemed like he was leaning more toward like it's probably okay. But I didn't really feel that way. I felt like he was more saying like it's still really up in the air. It's still really like nobody really knows. But in addition to seeing a cardiologist, he's also referring me to a geneticist to look at genetic things that could have caused the bicuspid aortic valve. So I thought that was interesting. I didn't really expect that, but that's something that will hopefully give us more answers on, maybe why I have this this type of valve issue, and also just sort of like helping me, and then like figuring out like is there a concern in terms of giving this to a baby, like passing this to a child. So that was really interesting. I've never been to a geneticist, so I'm, interested to see how that goes and see what kind of information they can give. And I think like I said, we both left the appointment really like on different levels. Like I felt like Sean seemed really confident and, comfortable with everything. And I still feel like, I don't know, because like, I guess we were like kind of talking about it. And I guess for me with my anxiety and OCD and everything, like I am looking for like a confident yes or a confident no. And that I'm learning is not going to exist, that certainty that, in a pregnancy, without a heart condition, without the mother having a heart condition, that is something that is, concerning. There are always risks in pregnancy. But it's just like, I don't know. It's just hard when you've heard so many people say like, no, or I don't know, or it's risky, like that. It puts this like feeling in like, it just gives you like a cautious feeling. Does that make sense? Or just gives you like a discomfort where you're like, it's like in your head, you're like, well, is this dangerous? Should I avoid this? Like, I don't want to put myself at risk, and so I feel like almost, like I'm not blaming the doctors for being cautious, but it's just like, it makes you think and it makes you question everything. I think that's probably the best way to describe it. I feel like I'm just questioning everything. And I even said to Sean before I went in there today, like I felt like I was going to go into the appointment and not like I wasn't going to get the answer that I wanted. And that was hard. Like I feel like I kind of set myself up to be like, not satisfied. And it's not that I'm not satisfied, but just like not comfortable with the outcome. You know, the doctor kept saying, like, this is a first step. Like he said, I feel like this is a first step in learning more about everything and really evaluating risk. And I guess I kind of thought today was kind of like a last step, I guess, in a way. Like I thought that going to this doctor was going to be like the final step in this process and we were going to get a definitive answer. But I just, I feel like I keep on getting like almost like, okay, like this person's like, I'm not sure, send you here. And then the person's like, I'm not sure, I'll send you here, and I'm happy to get the information and I want the most information that we can make the best decision we can. But sometimes it's just like, it's hard, it's hard to like hear one thing in one place and another thing in another place. Like it just makes you wary of it. It makes you concerned. So, I did ask the doctor about, pregnancy and what that would be like. And he said, for, which is, I think, a positive that, he wasn't ruling it out. At no point did he say, like, no, this is not going to happen. And as I said earlier, at no point did he say yes. He definitely was like on the, not on the fence about it, but he definitely was cautious. It seemed like cautiously optimistic though. Now that I'm like looking back at it, and I can see it a little more clearly, or at least think about it a little more clearly. But, I said to him, like, if I am able to carry a pregnancy, what would that look like? And he said, definitely that I would need to be seen, by them for my prenatal care, and that I would need to deliver at like a specialty hospital. So that, is important to know. He's saying that way, like, if there are any concerns, I would be at the best place possible to deliver because it's, it's a specialty area, I guess. We were able to get that information. I feel like keep saying I because I normally go to these appointments on my own, but Sean was there and it was amazing that he was able to be there. I felt really supported by him. He kept on just like kind of looking over at me. He was like making little silly faces and stuff like that and trying to make me laugh. Sean also asked some great questions too. He was able to articulate things when I wasn't really able to. And that was really helpful because sometimes I just get so nervous that I almost like freeze and I can't speak. I can't really say what I want to say. So pretty much I'm going to be waiting for a referral to this other cardiologist, like a maternal cardiac person, and then a referral to a geneticist. All of my records are going to be sent to him so that he can evaluate those. The main thing like that I took away from it too today was that there's so much conflicting information on either side. He was like saying, well, this study said this, and then he would talk about this other study and it said the complete opposite. And that's really what it felt like, which I thought was interesting. When I was at the appointment was that he was referencing a lot of studies, which I've never really been to an appointment like that, where they were like, oh, okay, well, according to this, journal, this test was done, this many people were tested, I've never been to an appointment like that where it was all like related to data and all of that kind of stuff, which makes sense because that's what it is, it's a data-driven process. He was really nice though. Like I felt like it was a very like thorough appointment and he gave us so much information. I felt like almost like we were sort of part of his thought process in a sense where he was sort of like, okay, well, I need to mention this, I need to talk about this. And then, he would ask us about something related to that and, the concerns that he had, but also like the confidence he had in certain things. And I think something that was, good was he never said no. It's not like I was, selfishly hoping that it was going to be like an absolute yes or an absolute no at this appointment, for pregnancy, like the safety of pregnancy, like, yes, you can absolutely carry a baby, or no, you cannot, you absolutely cannot carry a baby. And, we didn't get that at this appointment. And in my head, I knew that wasn't going to happen, but I was sort of hoping that it would be the end of the process in terms of learning about the specific situation. But, when he said, like, I feel like this is like the first step, I was like, no more first steps. I have the opportunity to get this information. I'm so grateful for healthcare and for, time that I can take off of work to go to these appointments, and I'm grateful to have a spouse that's so supportive in everything. And I'm grateful that he is looking at this positively, even when I feel kind of like, oh, this is so much information, and like frustrated. I guess I'm not frustrated. It's just like I thought it would go differently, I don't know. It kind of went exactly like I thought it was going to go, but at the same time, like, not at what I thought was going to happen. Like with medical stuff, there's always a risk and there's always a concern. And it's, what the doctors do is present the information to you, and then ultimately we have to make the decision. And I guess like it's hard because I feel like, it just feels like a lot of like pressure, I guess. I feel like, I'm just talking with you guys openly about it. Like, it just feels like, you get these, like, somebody says something to you, like, about how risky it is, and it hits you, like so fast and so hard, and you're just like, how am I going to function with this information, if that makes sense? And the first doctor said, I don't know that it's going to be safe for you. Like, that stuck with me, and that like, it was jarring, it was just such like an eye-opening, like unexpected thing. And it's almost like I can't shake that feeling. Does that make sense? Like I can't ignore how scary that felt and how like just terrified it made me feel. And like now it's like trying to weigh that, and and also like having doctors, one doctor say, no, I don't know that it's going to be possible. I'm not sure that it's going to be a good idea. And then another doctor saying, oh, it's going to be really high risk, but like, and then this doctor, kind of being like, it's, not yes or no, but like kind of like optimistically, kind of like yes. Like, I guess it just sort of, it makes it hard for you to like feel comfortable with anything. Does that make sense? If everybody's kind of saying something a little different. So I think I'm probably just like kind of being guarded as well. I'm just kind of, not getting my hopes up, but also not getting so disappointed because we still don't know everything yet, and we're still trying to find everything out. I'm so thankful though that I was able to get into that appointment today, because I really felt like it was going to take me forever to get in there, but it didn't take that long at all. So yeah, I'm so grateful that we had this appointment. I'm grateful that the doctor listened, and I'm grateful that Sean was there and we were able to, get this information together. That's sort of all for today's update on everything. Thank you all so much for your kind words on the last video that I shared about these appointments I've been going to, and I'm grateful for all of your stories and, sharing with me your history, and for all of your concern and support. It's, it's a lot to think about, and it's a lot to process, and it's a big decision either way, but I feel like adding on this like other medical piece to it, it's just a lot to think about. So, but, I'm grateful that we have healthcare that allows us to be able to look into this and, make informed decisions. So, thank you all so much for watching today's video, and, leave any comments or questions you have below. Again, I really appreciate all of your support and your kind words and your stories and encouragement. Like, it really means a lot to me. So, thank you all so much, and I will see you in my next video. Bye.